Hello, everyone. We are so excited to have our guest with us that is going to come on. Well, she's on now, and she is going to be presenting and talking to you more about what it means to be a social worker in the field of in social work of where she's at. And this is Lena Payne. She has worked at USC as a part-time faculty member since 2011, and she also works at the VA. She is in management at the VA, and she can tell you how long she's been there because I forgot to ask that question. And so we are just so excited to be able to have her here to share with us her knowledge because she has been in the field of social work for well over 19 years. And she has a lot of background of what she's been doing and working within the field of social work. So, Lena, can you please tell us what your role is in your current position and how long have you been in that position?
Sure. So, in addition to teaching part time in the MSW program that you mentioned, I work at the VA Loma Linda in Loma Linda, California. And I have a couple of different roles there. So, one of my jobs is I'm a supervisor that's over outpatient mental health in our community-based outpatient clinic. So what that means is our main VA hospital is in the city of Loma Linda, but we have 5 community clinics that are in the region. And so we offer a variety of medical services there, one of them being mental health. And so I am over mental health in those areas. Additionally, I'm the deputy chief of social work for our facility. So that includes our hospital and our community clinics. So that's a pretty big role. And then I also am very involved in our ethics program. So
Uh-oh, the video froze.
I think it froze, yeah.
Oh no. Hopefully she'll come back in a second. Let's give it a second. Internet connectivity. Sorry, you froze. So what we heard you say was you were involved in the ethics program. That's all.
Okay. Yeah, so I'm what they call a preventive ethics coordinator. So I look at gaps in processes that could be ethical concerns. So either we had something that was an ethical concern because of a gap, or it could cause potential harm in the future. And then we look to see if we can resolve that before it becomes a ongoing problem.
So if something were to occur, then that's a part of what the ethics, as an ethics coordinator, you would then look at what could you have done or what could the department could have done better to be more preventative for the whatever that issue was.
Yeah, so we look at it's for the facility, across the facility in all departments. And what I do is we look at processes, policies, resources, whatever it is that's causing the issue. So I also participate in our consultative ethics, which would be more like your ethical dilemmas and your ethical questions.
Okay.
So a lot of times we may pull kind of like something that catches our ear from an ethics consultation, or something that's reoccurring, so it could be a social worker or any profession, a nurse, a doctor brings up something and we think, oh, wow, this could be an issue for other people as well. Maybe we need to look at this on a bigger level. So that's what we'll also do.
Okay. Thank you for that.
Yeah, that's amazing. Well, we'll get into a little bit of that, and you probably have a lot of stories for us, but I know we won't have time for all of them. But so if we're talking about implicit bias, how do you see that impacting service delivery, and then maybe even, policies and procedures?
Yeah. So, I mean, as you know, implicit bias is those automatic biases that we have that we don't even think about most of the time. So they pop up every day in all types of interactions. And it can definitely affect service delivery in ways that we may not notice. And I think it's really important for all social workers to be very aware of what our biases are. We tend to have some that we're kind of aware of that we work on, and some that maybe we're not too aware of. And sometimes people may kind of point those out to us and we may not want to hear it. But I think as social workers, it's really important for us to be open. You know, social workers, we tend to work with the most disadvantaged or disenfranchised people there are. I mean, we serve a wide range of clients, and I think the social work field is known for being super open and to all different types of people. And so we have to be aware of our biases because, for instance, if I have a bias against any group, it may affect how I deliver services. It may affect what I think, how much effort I feel like I need to put in. If I think one group doesn't put in as much effort, then I might kind of write them off a little bit. If I think, oh, this is just, women tend to complain a lot, I may not take their concerns seriously. So I think it's really important for social workers to be aware of our biases. Yeah, and you see it a lot, I think, like at the VA, unintentionally a lot of times. Like, for instance, one of the things that you'll hear from people sometimes, especially if you talk to female veterans, so you may have a provider go out to the lobby to call a patient they've never seen before, and they will assume it's the male in the room.
Yes. Okay.
Yeah.
That's a great example. I mean, even when you were talking about that, it just made me think of, especially being in the hospital setting, right? But it made me think of one of the biases that, and you said service delivery, when we have the African-American women having high infant mortality rates, and just when they're pregnant, because medical professionals thinking, oh, you're not in that much pain, or when they have complained about something, they've been overlooked and not provided medications and certain things. And so we've seen a lot more in the media recently about that issue. And like you just said, may not put as much effort, or you may think they're over exaggerating because of your own biases.
Mm-hmm. Definitely.
So how would you, if you feel that, because that's something, like you said, some can be intentional, some can be unintentional. And have you had an instance where you've had to address, a bias with a social worker, or where someone may have had to do that with you? Or if you haven't, how would you approach that if you were aware?
Yeah. It's a very delicate thing to do. So I think, because most implicit, so there's like the outward, like known conscious bias, and then there's our implicit bias where sometimes we don't even realize we have it. And I think part of like making progress in this area is also creating an environment where people can make mistakes. Right? So like if you come at people too aggressively, then they'll get on the defensive, and then they won't learn. So I think as just people, as human beings, and as social workers who are often kind of the social justice warriors out there, I know that they use that as a negative term now, but I mean, I'm not going to use it as a negative term because social work has always been out there fighting for justice.
Yes.
We are usually the ones to point out when we see stuff like that. But we have to have a space for people to be able to say, I made a mistake. And also know that people may not see it at first.
Right.
But give them that space instead of, creating an environment where it's not okay to learn. So one instance, and I'll tell you, I was so nervous about it. I was on an interview panel, and it wasn't for a social worker because we have interdisciplinary panels. So I was on there. It was for a nurse, but we had different disciplines interviewing because the nurse would be working with us as social workers. And there was one of the applicants didn't speak very good English. She had a very strong accent. And so after we finished the interview, one of the members on the interview panel didn't really care for her. And I don't know what it was. I can't remember exactly what she said, but I just wanted to check. And I felt it so strongly that I needed to do it, but I knew it would be delicate and it may not go well. And so I'm sorry, but so I just kind of took a breath and I asked the person, did this person not speaking, like not having an accent, was that part of your decision making and not liking this candidate? And I was so nervous, because this is someone I really respect too. And I didn't want to have a bad relationship, but I also thought it was a good discussion to have, you know, when we talk about fair interviewing and hiring practices. And they were definitely thrown off. You could tell, shocked. But I think because of the relationship and knowing that I probably wouldn't be coming from a place of like just accusation and ill intent, you know, they were able to actually answer the question and we were able to have a discussion about it. And I actually felt really good at the end that that wasn't necessarily what was going on. But then at the same time, I also felt good knowing that that person knew that I noticed that. And, you know, I would know that they would be careful about that in the future in case that was just something they didn't realize that was going on. And it may or may not have been, but I think it's just, it's not always easy to have these discussions with people. But it's important to do it, but to do it in a way where people don't have to retreat from you so much, that they can kind of come back and have that conversation. And what's funny is this was a couple years ago, and I was just this week, this person and I talked about that incident. We interview together quite a bit on and off over the years. And we were able to kind of talk about it, and they were able to say that they were happy I brought it up, and that it was fine, you know?
Yeah.
Oh, that's awesome. Just from what you're saying, it's really about creating that culture or the climate where it's more of a learning environment and not punitive, so that you can have those difficult conversations, because it is very uncomfortable.
Right. And I hear, you know, a lot of times, just in general, people have difficulty with this topic, right? To talk about privilege and implicit bias, and even being okay to recognize that you have, right, certain privileges and certain biases. And so, you know, mostly what you're saying is make sure that you create the safe space, but then also make sure you understand your own biases, which is huge, right? Understand it, but then also be open to hearing about it, like she did in that example. So that's
that can be hard to hear about it, right? You're like, ooh, you know, when I've had to check myself with some of my own biases. And, you know, when you talk about privilege, oftentimes you're thinking about race, but no, it's like, you know, abilities and disabilities and certain things. I didn't realize, being a person of able, you know, that has abilities or whatever, and no physical disabilities, that there's certain things I just take for granted and don't even think about. So
well, what's interesting about that is, you know, the Harvard has that implicit bias test, right? And I know there's some, you know, it's not like perfect, those tests.
Oh, they're taking that in this class. So
Oh, they are. Okay. But it's very interesting. So, you know, you kind of come from this place where you think like, I've been working on this, I don't have this too much. And then you take it, and it can be shocking, right? And I was like, I'm going to take it again. Because I did not accept those results. So it's all work in progress.
I found that too. I've taken that test multiple times, like, you know, that it changes, and I like to take different topics just to see. So, right. I mean, I like what you're saying. It's being aware, because we all have our biases. It's being aware so that that our biases are not negatively impacting the work that we're doing with clients. Okay.
Right.
Thank you for that.
Yeah. And sometimes when we don't have that awareness, then that's where microaggressions can come into play, or in general, microaggressions come into play, right? And so do you think you can share some examples of what microaggressions look like to you, like in your role as a social worker?
Oh, sure. So microaggressions are one of those things where they can be so difficult to describe, right? Because you can experience them in a few different ways, right? Sometimes there's not just like one form that a microaggression can come. And actually, kind of linking back to what we just talked about with implicit bias and being open to hearing, I was in a presentation actually just a few days ago on microaggressions. And one of the things that really caught my ear from the presenter was that they said it was actually more harmful when you're with microaggressions, when it's our gut reaction to want to defend ourselves when someone points something out, and that's actually more harmful than the actual aggression that you did initially. So your defensive reaction of basically kind of denying or questioning someone else's experience is actually worse an experience as a more like a higher level aggression than the initial microaggression that they were bringing to your attention. And I thought that was super fascinating.
I mean, because I can see that, because if you're defensive, right, then that means you're going to be defending whatever it was,
Mhm.
the behavior they're saying that happened. And so you're going to try to justify, right, whatever it is that they're saying that you've done or whatever. I can
Yeah.
see.
And then it's like making it seem like it was okay that you did that, but
Mhm.
really wasn't. So you're dismissing the person's feelings.
Yeah.
Yeah.
Because it may be that you didn't intend to do something.
Right.
You know, like, so an example someone gave me of a microaggression that's not really like based on our clinical, but it's just such a like a thing that I've done it so many times I wouldn't realize that someone else would take it as a microaggression is one of my psychology colleagues was talking about how she was homeschooled and how when people find out she's homeschooled, they'll say, "Oh, you don't look like you're homeschooled. You seem so normal." Yeah. Right. And I was like, oh my God, I've probably said the same thing about that, like that. And
oh my gosh.
Yeah. Or like my daughter's an only child. And I know I've said stuff about, oh, like, I don't want you growing up like an only, you know, it's just like that.
I've said it to you. You're an only child. I know.
Yeah. But I mean, it's also like in the field, I've had it from colleagues who I really respect, who I think are trying to pay me a compliment sometimes, right? Those are the ones that are kind of like throw you off a little bit. Where I've had someone go, wow, you're like a very competent social worker, but they're not a social worker. So like they kind of have a bias against social workers.
Yeah.
And then they'll give me a compliment and I'm like, did you just insult all of social work? Or, you know, or I had a colleague who actually really likes me. And so it was very complex. And then also culturally, I share culture with this person. But I'm of mixed race. So I share like half of my racial identity with this person. And so this was like an Asian colleague. So I'm half Asian, half Black. And he was mentioning how smart I am. And he was talking about how he had read some research about Koreans being like having high intelligence and that, you know, I was also very intelligent, but he literally said that's from my mom's side of the family. He was smiling and stuff. He was really trying to compliment me.
Yeah.
And, you know, but it was very much like, whoa, like, did you really just say that? And, and I will say like, it definitely, like, I didn't feel comfortable in the moment saying anything to this person. And I think that's partially because of my lived experiences, being biracial and having heard comments like that in the past. But I think it definitely changed my relationship with this person. They probably don't know, you know. And so I think, though, in the workplace, we can do that to our colleagues or our clients or patients and not realize it, that, you know, people hear the things you say and they take it in. So that's also why it's really important to try our best. We're never perfect, but to try our best. And then again, if someone points it out, to try to be open, looking at it and learning.
Yeah.
Do you think there is a time frame or a limitation to bring something up if you notice something afterwards? Because sometimes in the moment we can go, oh, that didn't kind of feel right. And then you're thinking about it afterwards and you're like, wait a minute, right? So do you feel there should be a time limit? Like you can only bring something up at, you know, after a certain amount, a time frame? Or
I don't think so. I think it just depends on how you do it. You know, I think someone could be thrown off or like dismiss you, which wouldn't help the situation. If like it's been a few years and you feel angry and they don't know where it's coming from, that just might create some confusion. But I think you're right. Like so many times, like we don't, in the moment, we're just caught off guard. So sometimes it does take us like to leave the situation, come back, and then go have that conversation. And sometimes that's not a bad way of doing it because people may be more open to hearing like how you feel about a situation later too, because they're not in the midst of having just said it. You know,
it kind of takes away the emotions from it, right? So when you can step back with a clear eye and then come and address it, because if it's still bothering you and if it impacts your working relationship with the person, then it kind of sounds like it'd be a good idea to talk about it or bring it back up.
Yeah. I think the whole thing though with addressing biases or microaggressions in a workplace situation though, it's all about psychological safety and having a good culture of like an organization or a team that you're working with where you can do that. So while I would say like any time's a good time to have these conversations, I think it's really important to also recognize that sometimes the environment doesn't really promote that, which is a larger issue, not pertaining to the individuals. That's a cultural issue from the organization. And sometimes that has to change for meaningful conversations to be able to take place. I mean, they can maybe take place on one-on-one or in small groups, but I think it helps to have an environment of psychological safety.
So if you don't have that environment, right? Something about if there is no organizational change yet, and then the environment is not safe, then is that something where you just may not be able to bring it up, is what I'm hearing you say. If you feel that there's, as far as psychologically, you're not going to be safe to present this, or it's not going to be received well, or there may be some punitive reactionary things, is that something where?
Yeah, well, I would say, like, as like social workers, and we're trying to understand behavior, that might be a reason why someone may not bring something up right away. They may bring it up later when they feel like there's more of an opportunity to do so. And as social workers, I would say, we should strive to help create that environment. So, that was something that came up in my workplace, and I was hearing some complaints and concerns, and so were some of the other supervisors. And we put together, those of us who were concerned, a survey for the staff on DEI related issues to kind of get their feedback. And then that led us to starting a committee that was a staff level committee to address DEI. And then we also started a supervisor group, which I run the supervisor group. And then I'm the supervisor, like oversight for the staff group. And so that's how we had that presentation on microaggressions, is because the staff group brought that in. So we are creating a change culture, because if we don't like the culture we're in as social workers, we're pretty trained to make some changes. And so that's what we're doing.
All right, change agents.
Yeah, exactly. That's great for our students to hear, because them see that they can be a change agent, right? Like, and advocate for the culture. So
I love that.
Yes.
And so for you, you're working in the environment, right? Veteran population, service, men and women, service people, right? And what would you say, what kind of issues of diversity or equity inclusion do you see coming into play with the population?
Well, I mean, so the U.S. military is very diverse, right? In terms of a lot of things, especially in terms of like racial or cultural diversity. It was one of the first major organizations to integrate. So they have this history of being a very diverse organization, and veterans tend to have been exposed to a lot of different cultures. But even within the military being so diverse and kind of being a leader in promoting diversity, there's also still a lot of racism, segregation, cultural bias, religious bias, in the military, gender bias. So it's kind of an interesting dynamic, because it's an environment of people who have been pretty integrated in their careers, but still may have experienced a lot of hardships. And so I think, part of what we see, and the VA is such a large system, so the military and veterans is such a large group of people. We have some things that just mirror like health disparities and social disparities that you'll see in any other place, in terms of like socioeconomics, racial disparities based on racism or finances, things like that. So we do try to do things to help with that, because, of course, like socioeconomics is a big factor that leads to health disparity. So the VA is different in that we're not just a healthcare system. We also have benefits, like we have our own Section 8 housing program. We run our own project-based housing. We do a lot of socialized programs and pensions for veterans who don't have a lot of income. So it's a little different in terms of like the VA tries to meet a basic need for people. But we still have, definitely still have disparity in our system, geographical disparity, like rural, serving people in rural communities, but also, striving always to do better for our female veterans. And then I think it's also just being aware of cultural issues, right? So we're really pushing for clinicians to understand the experience of women in the military, and like I said, the experience of women coming to the VA, right? Assuming they're not vets. But then also, like, when you're assessing as a social worker or clinician, our veterans of different cultural backgrounds, sometimes. Like, I've interviewed some veterans for PTSD, and yes, they were deployed and they had trauma, but I've had some veterans that their biggest trauma was maybe the racism they experienced while they were in the military, and maybe how that affected a deployment or affected, maybe hazing that was done or something like that. So I think it's important to take all of that into context. And we actually, in our mental health intake a couple of years ago, we added a question that was really interesting when we rolled it out to see the clinician response. But we actually have a question that asks, does the patient have any concerns related to their racial or cultural identity that they would like to have addressed in their medical treatment plan? And a lot of times people will just say no, but we've gotten a lot of veterans that have said no, but thank you for asking me that question. No one's ever asked me that before. And then we have had some that have said yes, actually I do. Because what we kind of were noticing is when clinicians of color were interviewing patients of color, they would feel more comfortable bringing it up. But if they had like a Caucasian clinician and they were a patient of color, they didn't feel as comfortable. And sometimes they would ask for like a clinician of the same cultural, like ethnic background, so that way they could bring up those issues. And so having that question in the actual template, it gets everyone to ask it. And so then I think the veteran feels a little bit more comfortable being able to say, yes, actually. And then so what we noticed with that is that it created more referrals to our group that we have that focuses on race-based trauma.
Nice.
That's awesome. Yeah. I mean, just what you're saying too, it's kind of, would you say that it's a good idea for a social worker that's coming into the field and wants to work at the VA to be aware of the veteran population, or as far as the culture, before they start to work with them?
I think you can learn the culture. I don't think you have to have a ton of familiarity with the military culture, but I think you have to be aware that maybe a lot of what you know, if you weren't a part of the military culture or didn't grow up in it, is maybe not true. So there's, when you talk to a lot of veterans, one of the things they'll talk about is how like civilians assume the military experience is what they see in the movies, right? And so there's an assumption that everyone who has trauma or PTSD got it from war. But the reality is most veterans, most service members in the military aren't fighting in combat. And even a big population of those deployed into combat zones are not actually in combat. But there's this assumption, or people will ask, like, did you kill people? Or there's so many other experiences you can have, and so many different ways to serve. But people come in with what they think, what they've learned from movies. And so.
You're right. I just watched a movie last night, and the guy asked the other, one of the main characters, he was a veteran, and he served in, what was it? I think he was a Marine. So the guy said, "Oh, how many people did you kill?" Right? And that was in the movie. So it's kind of what you're saying.
Yeah. Yeah. And sometimes because of that reaction, that can create internalized stress or doubt. Like, I was talking to a veteran who I'm treating for PTSD now, African-American male. And so part of what we're talking about is race, but we're also talking about trauma from Afghanistan. But even like with the trauma, like, he feels like his trauma is not as bad as other people's traumas because he was transporting dead bodies, but he wasn't killing people. So like, should I complain about this trauma and get treatment? So I think we have to be aware of, like, when we bring in that thought too, and we assume that that's the experience, then we're reinforcing that negative stereotype even they have, that makes it seem like they shouldn't bring up their trauma because it's not as big of a deal or it's not as important. We don't compare trauma, so it's all important. Yeah.
That's a really good point. You mentioned in your assessments that you all try to make it relevant, and which is great, culturally relevant. And so one of the questions we have, one of our last questions is, so do you all, for the military or the veteran population, does anything stand out to you in terms of any culturally relevant services or practices other than kind of your assessment that you all do?
Let me make sure I'm understanding. You mean like that we're doing as clinicians that would be related to culture?
Yeah, so culturally relevant services, or even just within your military population. So any type of culturally relevant services that you provide. Do you provide any?
Well, I'm trying to think. So
would it be the same if you had a veteran that was a clinician and, working with another veteran? I don't know if that would be considered.
Well, so that does come up quite a bit, right?
Sorry,
yeah, where a veteran will come in and request another veteran. So, and we do try to accommodate that if possible. But I think, in general, as you come on, if you're going to work with the military veterans, you don't have to know everything at first about the culture. You just have to be open to learning and open to knowing that one person's experience isn't everyone's experience. And so there's going to be different cultures that they already had, like different diversity factors that they bring in from their childhood and life, than what branch of the military they were in, because those are very distinct cultures. Then like within those branches, like what did they do? What were their experiences? So I think it's all super relevant. And if you're open to learning and asking, that's what you have to do. And you also have to be prepared if you're a civilian clinician coming in, that someone's going to ask you, hey, are you a veteran? And are you going to be able to help me because you didn't go through what I went through? And you have to be okay with that, like okay with people's fears, that maybe you're not going to be the right person for them. And then we learn how to address that. Through our practice, so there's a lot of things that we try to do to accommodate a person's like wishes, but also it's about really making an effort to learn the military culture once you're in that system, and making sure that you're open to feedback, you're open to learning, that you're doing your best, and you're not offended too when they ask you those questions.
Right. Yeah.
I like that when you're saying, I worked at the VA and I worked with Lena, and I really loved the veteran population. It was so different, and I had never worked with the veteran population. I really did enjoy it, and a part of how I was able to get in with the population was because my husband is a veteran, and so when they would ask the question, "Oh, my husband's a vet," they go, "Oh, you understand," and so it kind of like they would let me in a little bit quicker, that kind of thing. And so I like what you said, it's just being open. As long as you're open, to hearing their stories without having these preconceived notions, and, then it's going to really assist with that engagement piece, right?
Yeah, because you don't have to have experienced the same thing. Because even when we do give them a veteran clinician, most of the time those veteran clinicians didn't do the same thing they did anyway.
Exactly. Yeah.
But there's a comfort factor. So we try to get that comfort. And what I tell our students, our interns, and new social workers who are veterans, because we love to hire veterans at the VA, but I tell them they still need to become competent social workers, because if the only way you can connect to a veteran is by saying you're a vet, then you still haven't learned what you needed to learn. Because you should still be able to connect and work with a person even if you're not. If that's the only tool in your bag of tricks, it's only going to get you so far.
Right. Yeah. Oh, that's wonderful.
I like that. I mean, that's great. Thank you for that. Is there anything else that you would like to, say, or any advice or any feedback you want to give to our students, our MSW students who will soon be going out into the field?
Oh, well, I just want to say that working with the military and veterans, it's very different, but it's very rewarding. So if anyone has an interest, I encourage you to explore it. We love hiring social workers. We love training social workers, and social workers are a huge part. I think the VA actually employs more social workers than any other organization in the nation. And even at our little facility in Loma Linda, we have over 200 social workers. So,
Wow.
yeah, so don't be afraid to branch out and try something new. It's just like Dr. Arkadie said, it's a great population to work with, very rewarding to work with people who served, who help serve our country, and then you get to serve them.
I love that call of action.
Yeah, thank you.
You notice that?
Well, thank you so much for taking the time to, let us interview you and discuss these questions to assist our social workers our social work students, so they can have a better understanding when we're talking about social work practitioners, and when they're working in the field, some things that they need to be aware of so that they can ensure that they are doing and providing services that are not only, have more cultural competence and humility, but that they can be aware, have that self-awareness of their own biases,
right,
and advocate, when they do notice some microaggressions.
Yeah. Thank you.
All righty. Thanks so much.